Hey there, friends. It's Dr. Russ in Portland. We spend a lot of time in our lives and in our exercise in this plane, flexion extension. Lately, we've also focused a bit on rotational strength. Today, we're going to really focus our rotational strength and stabilization on the hips and the lower back. We're going to practice having a neutral, relaxed, supported, and stable lower back while we move our hip joints in different directions. For this, all you're going to need is something to prop your head on, a block, a pillow, a phone book if you're from the old school. I want you to think about, while we're doing this, the hip is the ball and socket here. And we're really going to be doing a lot of spinning in this plane, in this plane, and in this plane, and in combinations of those planes. We're also going to be thinking a lot about the position, stability, and relaxation of our lower back. It's natural when you're lying on your side for your lumbar spine to sort of sag a little bit toward the table. We're going to be working on supporting our lumbar spine in a neutral position while we're lying on our side, which means engaging the deep side body on the downside, the mat side. So we're going to be working with this action quite a bit today, both working through this very small but important range of motion and also holding here while we spin and move on the upside hip. This exercise series comes from my work with my Pilates instructor, Lily Matson. So I want to shout out Lily and give her credit. I will link to her channel in this video description. I also want to clarify a couple of terms before we start. When you're laying on your side on a mat or a table, the side that's touching the mat is the downside, and the side that's closer to the ceiling is the upside. So sometimes I'll be referring to left and right, but sometimes I'm going to refer to upside and downside because it's less confusing. We also have the terms proximal and distal. Proximal muscles are the muscles that are closer to the center of the body. The big gluteals, the psoas, the hip flexors, those are our proximal muscles. And we have distal muscles, which are in the lower extremity, more the muscles of the calves and the feet. And this is relevant because in this series, we really want to be focusing on using our proximal muscles as much as possible. And I also am going to be talking today about the pelvic floor, which is this sling of muscles that runs from the pubic bone to the tailbone, from sit bone to sit bone, supports your pelvic organs. We need to keep our pelvic floor relaxed while we're doing most of these movements. If you're not sure where your pelvic floor is or what it feels like from the inside, here is a link to a video of me talking you through how to find it. What does it feel like? How do you sense it? How do you keep it relaxed and softened? All that said, let's get into the movement. Start lying on your right side. So your right side is the downside. Your knees are bent. You want your shoulders and hips aligned. Maybe you can use the back of your mat, or if you're really not sure, go up against a wall so you can make sure that your lower back, your upper back, and your hips are all in line. Head is comfortable, shoulders stacked. So we're not opened to the ceiling. We're also not closed off, pointing to the floor. If the point of your shoulder is kind of pointy, it's okay to be on that shoulder blade on the downside, but you just don't want to be upper body rocked forward or rocked back. Similarly, pelvis is stacked. So your pelvis isn't open to the ceiling or open to the floor. It's really as perpendicular to the floor or to the mat as you can get it. And we're going to start by contracting our downside abdominals to lift that lower spine off the mat and relax. So that movement is small. You can think about lifting the spine off the mat, or you can think about pushing the upside hip toward the heel. And we're going to go through this a few times. If you're familiar with any of my other low back stability exercise routines, you know, keep doing this gently. You know that we do a lot of imprint when we're laying on our back. This is sort of like that imprint, but instead of imprinting into the mat, we're lifting up off of the mat. I'll pull my shirt tight so you can see. Here's the relaxed state, and this is fine, but what we're going for is neutral, which is a bit of a lift like this. This is really different than a side plank, right? I'm not like lifting up. My shoulders are relaxed. There's no push with the knees. The pelvic floor is relaxed. It's a lift. and a lower. Let's do 2 more here. Lifting, lowering, pushing the upside hip toward the heel, and then relax. Now we're going to do 1 more and we're going to hold. We're going to hold this and see if you can hold that, straighten the top leg, and lift and lower just a few times. So all the movement of the hip, all the movement of the leg is here in the ball and socket. There's some spin happening there. The pelvis isn't moving. Here's what it looks like if we're doing it wrong. Hiking the hip up, losing the lift on the downside. We're not going for this. This is a fine exercise, but this is not what we're doing today. Today, we're getting a nice lift on the downside, keeping our tailbone untucked, and just a couple more lift and lower of the upside leg. Set it down, knees together, heels stacked. Give your low back a little relaxation. And really feel how different it feels when you let go of the downside and you let your spine sink toward the mat, as opposed to when you're holding it up. It's really, really very, very different. It doesn't look like much, but it is. Now let's let ourselves sag into the mat. The pelvis, the low back is really relaxed, and just do a couple of easy clamshells here. So the heels stay together, you lift and lower the knee. We want the spin to happen in the ball and socket. So as the knee lifts, there's no opening toward the ceiling. The pelvis really stays perpendicular. Your belly button stays pointing straight forward. Just 2 more. Going at your own pace, of course. Now relax and give yourself a little bit of that lift. So the right side contracts, the left hip, the top side hip pushes long, and now we're engaged through the right, the downside, internal and external obliques, giving our spine some support. Now let's see if we can maintain that support while we do 6 more clamshells. Check in with that pelvic floor. There's no need to be tensing it up. All this movement is coming from the proximal muscles of the side of the hip. 3 more. If you lose the support for your lumbar spine, that's okay. Stop, recommit, and do it again. Okay, we're going to go into some sustained action now. It might start to feel a little bit burny. So you're going to lift the downside, pushing the top hip long. We're going to do 3 clamshells here, holding this just like we did a minute ago. Still just getting warmed up. And on the 3rd, hold it up. So we're holding in an open clamshell. The belly button stays forward. The bottom, the downside, is lifted off the mat. The top side hip is pushed long. Now it gets a little tricky. Keeping the knee where it is in space, lift the heel off of the other heel and bring yourself into a full internal rotation. So from a clamshell into full internal, the thigh bone, the knee stays where it is in space, the thigh bone spins, and the ball spins in the socket while you are maintaining a relaxed, neutral lower spine. This is not easy. We're going to do 1 more. Hold there. Hold here. So we're in a static position, just working against gravity. Don't forget to breathe. Check in with that pelvic floor. There's no need to hold it. Check in with your tailbone. There's no need to tuck it. Now bring the heel in line with the knee. So the knee and the ankle and the foot are all in one plane, and holding them in one plane, we're going to do bent knee abduction. Up and down, holding good, strong, but relaxed, neutral spine. That downside is holding up your spine, not letting you sag into the mat. Hold it up. If you need a break, take a break. This is starting to burn a little bit for me. Check in with your feet. Are your toes trying to accomplish this movement? They shouldn't be. This is a proximal muscle activity. Bring it up, bring it down. Leg is long. So we're really challenging our endurance here. Point the toes to the floor, point the toes to the ceiling. Really, it's your knee that's rolling because the movement is happening in the hip. And as the knee points toward the floor, bring your foot down to the floor and then up and back behind you. This is totally targeting the glute max muscle, the big, strong muscle of the butt. Checking in with your lower back, not opening towards the ceiling or the floor. Give yourself 2 more. This is really burning. Last one. Hold it up and then bring it down. Whew. That can start to get kind of burny. Tap out that glute a little bit. Give that posterior hip just a little bit of percussive love. Take your time. We're going to turn over and do the other side. On your left side now, let's check in and make sure, are we properly aligned? So the shoulders, the mid back, the lower back, and the hips all in one line. The knees are tucked in front of you. The tailbone is untucked. Your butt is sticking out a little bit. That pelvic floor relaxed. Hips perpendicular, shoulders perpendicular to the floor. And let's just start with a gentle lift on the left side. So the left is now the downside. Pushing that right upside hip long. That pulls the spine up off the mat. Some contraction in the left oblique abdominals. This is not a side plank. It's not a big movement. It's a gentle lift, but it's really important. Training our lower body to move the hips independently of the lower back, allowing the lower back to stay stable, relaxed, strong, and open. It's not stable because it's tight and clamped. It's not stable because it's out of balance. It's stable because it's in a neutral, relaxed, balanced position. Hold yourself into this lift now. And all of the muscles, the small and large muscles that support the spine, are relaxed and ready. When everything is tight, there's nowhere for them to go. There's nothing for your body to call on to support you because all the muscles are already contracted. Holding yourself up, holding that lift in the left lumbar, send that right leg long, lift and lower gently. Does not matter at all how big this movement is. What matters is that it is contained to the ball and socket, that the lower back and the pelvis are stable, and that the lumbar spine is lifted off the mat, just like we're showing here. 3 more. Toes relaxed. I tend to really contract my toes when I do this. There's no need for that. Bring it in. Ankles stacked, knees stacked. Let your lower body relax. Let the lumbar spine sink into the floor and do some clamshells. And you can see on me, my range of motion on the right side is not nearly what is on the left. That's okay. Nobody is symmetrical. You don't need symmetry to have balance. 2 more. And then let that rest and lift that left side. So that left side contracts, the upside hip goes long, and holding that, lift and lower into your clamshell. Slowly, really focusing the effort on the back pocket of that right upside hip. 2 more. And then we're going to hold in our clamshell, pelvis neutral, lumbar spine neutral because we've lifted it up a little bit. The knee stays where it is in space, and we lift and lower the foot. Yeah, spinning that thigh bone in the hip socket. This is where the endurance really usually starts to kick in for me. Feeling that burn in the back pocket feels really good. Now the ankle comes down to be level with the knee and holding our lumbar spine stable still. We have not let go yet. We're lifting and lowering the right hip. Laying on the left side. Check your pelvic floor. Let that be relaxed. Check your low back. Tailbone untucked. Bring it up and come straight. Spin the thigh bone in the hip socket. Knee to the ceiling, knee to the floor, knee to the ceiling, knee to the floor. Are you trying to do this with your ankle? If so, reset. Knee to the floor, bring it down and up. Toe toward the floor with the knee pointing down, up and down. Really feeling that in the glute max. It is such a good burn right here. Checking in with my left side, making sure I'm lifted. This is not easy. Last one, you can do it. You're doing so good. And then slowly let it down. Give your hip a little bit of love. Thanks for coming on this journey with me today into the deepest muscles of your hip, getting strength and endurance in there with a relaxed, open, supported, and stable lower back. If you do this several times a week, this will pay enormous dividends in the function, strength, and the comfort of your whole lower body. This has been Dr. Russ in Portland. Thank you for doing this with me today. If you like this video, check out my channel. I got lots more. See you again soon.